Hello, everyone. Thanks for joining us today for our webinar on better patient engagement and better care. My name is Yvonne Ramaya. I'm with the TELUS Health team here. I'm the account support rep. So today we'll be muting this conference. If you do have any questions throughout the conference, please feel free to ask them in the Q&A section, and we'll do our best to get to them before we finish up. To ask any question, you can select the chat button in the middle of the center of the icons on your screen. You can see the icon on a current slide right now. And then when asking questions, ensure that you select to send to all attendees. Finally, you can zoom in and out of a presentation using the option on the left of the screen. Today, I'm very excited to introduce our partner, Cliniconex. For those not familiar, Cliniconex offers patient engagement services to provide better care for patients and a more productive work environment for healthcare professionals. We're talking about services and solutions for pre- and post-visit patient communication capabilities, optimizing your walk-in clinic, waiting room experiences, and overall helping you manage your patient expectations. Most recently, Cliniconex has launched HQI, a patient experience and engagement platform, which we'll hear about later in this webinar. So today we're joined by Darcy McHale, the Manager of Business Development at Cliniconex, and Kathy Deschennes, the Director of Client Success. You guys can take it away.
Thanks, Yvonne. Good morning, good afternoon, everyone, depending on where you are. We're here today to talk about patient engagement and the patient journey from before, during, and after provider care. So with that said, I'll set to work on getting going with our agenda. So thought it best to start off with a bit of information about Cliniconex, who we are, speak to the patient engagement, and then the different segment of services we have surrounding that patient journey that I just mentioned, all with intended outcome of continuous quality improvement, operational excellence, which means different things to different people. It could be reducing the burden or really reducing costs, but really creating efficiencies, and then mass personalization across the full spectrum of the different things that you would want to remind a patient on. So with that said, a little bit about Cliniconex. We've been in market for about 9 years now. We service over 4,600 providers to date in about 80 different subspecialties. We are north of 550,000 unique engagements on a monthly basis. And that can be everything from a text message to a voicemail through to an email. And the patient segments to which we service are patient engagement in the ambulatory and acute settings that have everything to do with patient engagement for appointment reminders and getting the voice of the patient through to resident family engagement in long-term care space. So with that said, more than 25,000 patients are engaged by Cliniconex every day, and cumulatively over those 9 years, we're well north of 15 million unique reminders. So the point we're trying to get across is that we're well established, well vetted, and certainly battle tested in what we do. So from a partnering standpoint with TELUS, the EMRs to which we have integration with and service are Wolf, PS Suite, and MedAccess. So good news, if you're on any of those, we can certainly support you through integration. So really taking the standpoint of the medical office administrator and the front-end staff, it's a huge burden. There's a lot to manage, and it's not just getting set up for the appointment. In fact, it's within the appointment, and then it's the continuum of ongoing engagement after. And those services can be broken down from before through to waitlist management, managing booking notifications, reminding on appointments, and even managing things like clinic cancellations, inclement weather, a provider being called out for something else, et cetera. But dealing with all those different things in the appointment or during the appointment, it's everything from greeting the patients to managing the no-shows, rescheduling, and making sure the schedule's optimized, through to communicating wait times, either by way of a website, telephone, or actually in the waiting room itself, and then after calling people back for their appointments, executing on health campaigns, and really looking at deploying and managing and compiling data around patient surveys and preventative care. So we've built or stacked our services around this to squarely manage those different things that the front-end staff have to manage on behalf of the provider. And so we're going to talk to you about that full journey of before, during, and after, breaking it down that way and distilling down the different services. So we'll start with before the appointment, and it's really about reducing no-shows, increasing revenue, and lessening the burden on your front-end staff through automated patient engagement, and really talking about the burden of patient engagement and really why it's being done. And basically, outreach is a burden on your staff, but without it, no-show rates rise and schedules are no longer optimized, and you have an ineffective operation. But also from the patient's side, you run the risk of patient satisfaction going down and creating a negative sentiment, negative environment. And so our service is about reaching those patients at any time, on any device, by a preferred method, either preferred method of the provider on how you engage with your patients, or the patient themselves saying, look, I really prefer a text message over a voicemail or email, and I would prefer to actually deal with this at my leisure. I'd rather not deal with this while I'm at work or while I'm preparing dinner or any time that I perceive as interruption. But I need the information so that I can make a decision and be well informed. And so it's really about integrating with the EMR and taking the necessary data out, matching it to what it is you're trying to execute on, and delivering it to the patient so that they can have a succinct message as to why you're reaching out to them, what you need to know or what they need to know, and then giving the information back to the provider so they can put it back, and it can be automatically put back in the EMR so that you know status. A message was sent, it was received, it's been confirmed, it's been canceled, there's a request for follow-up, etc. And so we call this workflow automation. And workflow automation is paramount, and it's a huge differentiator. And it may be apparent to some, but not to everyone what this means. And so we thought it best to distill it down and really talking about, and perhaps this is an overly used phrase, the uniqueness of your operation and mapping what you do specifically in your environment against a technology, rather than trying to implement a technology where you have to reset on the way that you do things. And so it's all about interacting with you on a one-to-one basis and understanding, which types of appointments you might want to remind on and which types you don't. How many days in advance? If there's any special messaging, grouping of appointments, information that someone might need to know, even attachments, if this, then that, if that, then this type of information, and then choosing the preferred method from a clinical standpoint. You may say unilaterally across the board, we want to start with voicemails and then go to text as a default. Of course, we're going to incorporate things like special messaging and branding, letting people know not to park in the Starbucks parking lot across the street, or things to remember, things to bring, things to know, things to be prepared for. So when you arrive, you're best prepared and informed with aligned expectations. Of course, things like provider numbers, names, caller ID, logos, all those things are mapped against our technology. So when it's deployed, that workflow that we're automating that is likely manual today, or for the most part manual, will be completely automated without any misses and without gaps and leaving you wondering, I've deployed the solution, but I'm not quite sure it's going to be messaging and interacting with my patients the way that I used to. You can rest assured that our system, and this may sound a bit pitchy or catchy, is a set and forget it type of environment. So I thought about the provider, but from a patient standpoint, the patient also has the ability to say, I like the fact that you're letting me know, and I like the fact that it's a automated attendant, but really a text message would probably suit me best. And so it's about aligning expectations on both sides of the relationship. So workflow is the uniqueness that is you, and workflow is mapping why you do the things you do against the technology. But why is it important? We kind of thought it best to use the analogy of a patient who may have 3 appointments in one day. And, typically other solutions would see an environment where that recipient of that information would receive it 3 different times, and it would be 3 different sets of information. And we're not proposing that people aren't clever enough to distill it down and say, okay, this is about my one day with these 3 different things happening, and these are the things I need to know. But why does it have to be so complicated on the receiving end as a patient? Why can't it be merged together? Why can't there be a business intelligence behind it where that content is collapsed down into one very succinct message that lets Chris know that he has an appointment on December the 12th with Dr. Duchesne, Dr. Jones, and a dietitian, and that these are the 3 different times, and these are the things that Chris needs to know in preparation. So that's why workflow is important. That's how we differentiate, and that's how we map your specific business rules to our technology. So again, it's about setting an appointment in your EMR, in your scheduler, letting Cliniconex automatically and autonomously send that information across, letting the patient receive it in their preferred modality, and then actually having them action, confirm, cancel, request more information, and then updating that status in the EMR. So there's no mystery around what's going on at any particular point in time with your patient outreach and engagement. And so the way that it looks, and this is just meant to be representative of an EMR scheduler, but basically you would schedule the appointment in the EMR. Cliniconex would automatically pick up on that. They would let Darcy know that he has an appointment and that I have an option to confirm or to cancel. I, of course, will confirm that I have that appointment, and as a follow-up, it will send me everything I need to know about that appointment. From a closed-loop perspective, you as a provider will receive an update saying Darcy's confirmed, and therein 100% optimizing your schedule and making sure that it's totally taken care of from a confirmed standpoint. You know exactly and have clarity into what your confirmed calendar is all about. And so, yes, I've talked a lot about text messaging, and please don't take that to mean that we only do text messaging. In fact, voice reminders makes up the lion's share of the unique engagements that we make, but text and email have significant shares as well. So just as an example, here's what a text message looks like, and here's what an appointment reminder might look like by way of email message. And then lastly, an audio script message. And so, yes, of course, we have templates, and we have messaging that is standardized across the board. That's not to say that we don't work with all the providers to understand specifically how they want their message executed on, what exactly they want to say, and what calls to action they do or don't want to have. And so these are simply examples of a construct. It's by no means a limitation. So from a before appointment standpoint, we're really only spoken about things that pertain to appointment reminders, but that can be a booking notification, a referral, a cancellation. They all distill down to that appointment reminder suite of services where that type of functionality is delivered on. So before we get into the during part of our bucket of service offerings, let's just do a quick case study on University of Ottawa, who's implemented our appointment reminders. And a little bit about them: they were an academic family center with multiple locations. They, of course, were providing cutting-edge care for their families, and they were using MedAccess as their EMR. The problem that they had was a long waiting list and high demand for access to providers. And compounding the issue is that they had a high no-show rate of about 8.5%. And so they knew that they had this problem, and they were attempting to manage it by way of manual process, but they engaged with Cliniconex to have us really automate the way that they were doing things with an intended outcome of improving the environment. And that's exactly what happened. They experienced a 60% reduction in no-shows in implementing Cliniconex in June of 2017 for appointment reminders via text, voice, and email. Patients reported that they certainly appreciate the convenience of getting a reminder on the phone and responding to it at their convenience. They also appreciate the ability to move up the schedule should there be a cancellation. And really the system is saving their staff a lot of time. So it lets them manage their time more efficiently, and it saves patients from being exposed to wait times. And so there you go. That's the before the appointment spectrum of services that we provide. So this is meant to speak to the during the appointment services that Cliniconex provides, and they fall under the suite of waiting room concierge. So it's about improving the patient experience by setting and aligning expectations with them, and in doing it in a couple of different ways. But first, it's again about creating an environment that sees less frustration. Now, we're proposing that there's a 30% wait time as an average, as a whole. I would argue that it's probably far greater. And the sentiment which it creates, it really sets the tone for their interaction with the front-end staff. It sets the interaction with the provider. It can really be difficult when you're not managing people's expectations and they're not aware that someone who may have entered after them, who has seen before them, may be seeing a totally different provider. And so you've got a lot of opportunities for people to really not know where they are, what's going on, and when they'll be seen next. And so we're managing this by way of our service offering in 3 unique ways. And the first way is a wait time display, which is a wait time tool where you can communicate projected wait time. The second is a patient queue where you can actually let people know where they reside in the queue, and that can be per provider, so you can deploy multiple queues. And so you can see that myself, I'm in one queue with Dr. Yvonne, and Kathy's in another queue with Dr. Patrick. And should Kathy go ahead of me, well, that's okay, because she's not waiting to see my provider. And then the last aspect of it is providing some flexibility for those in the waiting room to actually leave and come back when it's time to be seen by the provider. So I'll break it down just quickly. The wait time display, I know that some providers on the phone will likely have some type of wait time display that they're on their website. And I would argue that it likely requires your front-end staff to come up with some best guess determination as to, there's 20 people in the waiting room, so based on the way things go, it's probably going to be a half an hour wait. I'll throw that up on the website. But perhaps they become burdened and they don't get to it. And the last time it was updated was an hour or more ago, and it's no longer accurate. So our wait time display actually has some business intelligence behind it that's working with your unique scheduler and your unique calendar and understanding, okay, algorithmically, this is what the wait time is, and this is what we should be putting up, and putting it up in intervals that you define, every 2 minutes, every 4 minutes, every 10 minutes, however long. But net outcome is, in fact, that you have an accurate wait time that's being managed effectively that requires no human intervention. You can put this up on your website to align expectations, but also there's a generation of patients who don't really have a set provider. In fact, they're descending upon healthcare providers based on the wait times, and so this is, in effect, a great tool to actually attract people to your clinic. And then it can also be at point of entry. So when you enter into your clinic or a street front, where have you, you can be projecting the wait time out to people and letting them know what's going on and basically how long. It can be, of course, managing your logos, your coloring, the language of your choice, configurable really to match your branding and your unique requirements. Now that you have people in the wait room, either coming in for the appointment that they've been booked and reminded on, or people who've come into the walk-in, really letting them know where they reside in the queue is paramount. You know, letting the people understand where they are and when they'll be seen next and how many people are in front of them. So that's what the patient-provider queue is all about. And then leave and return messaging can be threshold set based on each individual provider's business rules. So some may say if the wait's greater than half an hour, some may say 45 minutes, others may say an hour, but ultimately saying, hey, Kathy, your wait's going to be greater than an hour. There's a Starbucks and a Sobeys and a dry cleaner and a few other people down the road. You likely want to get out of here and not be sat with a bunch of sick people for an hour or more. Why don't you simply raise your hand and say, you know, I'd like to leave, and we'll send you a text reminder or voice or email when it's time to come back, you know, and that could be 10 minutes or 15 minutes. And essentially it allows your patients the flexibility to not sit in your waiting room and not be exposed to things that they don't want to be, and really creates a really positive environment. A little bit about the queue is that there's multiple layouts, and so it can be a singular queue for your clinic. It could be 2 provider or more provider queue, but ultimately there's a lot of flexibility in the way that this is set up and what you can do with it, and it can also be merged together. You can have a patient queue and a wait time display, and you can in fact also have some type of call to action, few clinic shots, all those different things coming up. And so it's really a robust tool that lets you communicate with your patients without actually having to pull resources from frontline service or more meaningful tasks within the clinic. So again, we thought it would be prudent to sort of proof is in the pudding, proof is in a customer engagement. And so South Bank Medical Center implemented the waiting room concierge, and basically they did so because they had a really high volume waiting room, and they also offer walk-ins. And they had a problem with long wait times with no clear expectations being set. And as a result, there was constant interruptions to their frontline staff. You know, I was walking up and saying, hey, that Kathy lady in the black sweater arrived after and has been seen before me. What's going on? Where am I? What's happening? And I know that that's probably not something that's going to take 8 hours of the workday, but certainly 15, 20 minutes out of a work hour, and can be disruptive and really creates an environment for negative sentiment. And so they had a problem. They were also receiving inbound calls, people asking how long the wait time was as well. So it was in the clinic, it was external pressures, everything coming together to create a problem, to which they leveraged our wait time display and queue. And so it really, their feedback was it only took a couple of minutes on learning how to do the wait time display, because it's an autonomous tool that works in the background and learns a little bit about what that particular provider is doing in their calendar. But the sentiment from the patients has been really, really positive. You've got 3 here that talk about, you know, accurate wait times, aligned expectations. The last one here from Grace talks about the fact that she actually deployed the leave and return messaging. So it's real, it's out there, people are using it, and as a result, it's a really positive environment for both the provider and the patient. So that was the during component of our conversation about the patient journey. This is the after, the continuum of engaging with your patients to learn a little bit more about them, what's happening with them, and what you can do to better align. So it's really about helping raise response rates in a more accurate way to manage your data and increase patients' literacy around practice operations. And so, you know, managing surveys and putting your arms around this data is no small feat whatsoever. It's really time-consuming to gather the data and then to manage and merge it in a way that you can actually make it actionable. It really consumes a ton of time. Response rates tend to be low because perhaps it's not well targeted to the recipient. There just really is no efficient way of managing and cross-referencing this data, you know, as a whole, let alone by data segment being geography, demographic, age, sex, whatever have you. So we deployed HQI as a response to that, and it's basically a patient engagement experience platform that integrates with GMR and allows you to automatically survey patients post-appointment, and allows you to send health promotion campaigns and analyze results, not only with your as a provider or a practice as a whole, but also with your peers within that region or within that practice, and to set goals and to start aligning and measuring and tracking against those goals. And so it kind of looks like this on the front end. You may have had someone come in and you might want to give them information about breast cancer screening. And of course, they're not going to receive all these if you're 40 to 49 or 50 to 59 or 69 to 70. This would map their profile and would send them specific information relevant to them, and would give them that continuum of healthcare education. At the end of it, you can say, you know, as a provider or as a practice, your experience is important to me. Can you please take a few moments to let me know about your experiences with us? And really, it can be executed as a survey, probably something you've seen before, with your specific data points that you want to gather and the type of information you'd want to get, but ultimately giving you outcome data that allows you to do something meaningful with it. And so here within the screenshot, you can see that this provider is looking at accessibility and continuity of care and patient-provider information and safety information, and they're looking at their scores of you know, their score versus their peer scores. This right here could be a threshold or goal that they set for themselves, and they can see how they're actually driving towards that. How is their performance this survey versus last survey, and so on and so forth. And the ability to actually go provider by provider and be able to slice and dice that data whereas you're able to get clear, meaningful insight about yourself as a provider or as a practice, as a business. And then it may actually lend some surprising insights to which you didn't know, some things you might want to action, and there's functionalities there to actually create a plan and drive against that. And ultimately, what you can do is you can pull out these different data sets and you can say, okay, you know what, I found this information interesting, and I found that this is something I want to follow up on. And so really what it's creating is a bookmark, a library, a repository of all those different things as a provider or practice that you find interesting, meaningful, important that you want to action on, and then allows you to prepare a plan from there and set some type of goals to let you know what your last score is, what your peer scores are, the deltas between that, and then be able to actually set a target. Also a really unique identifier or differentiator is that when we say now, a month, 3 months, 6 months, or a custom range of when to send this information next, it's not a broad brush as a whole. It's unique to Darcy. It's unique to Kathy. And so it's that unique moment in time that resonates with them most. I may have just been in care and get this. Kathy may have been, last time she was at the clinic was 6 months ago, and why the heck am I getting this? I'm not going to respond to this. So it's really well timed, and it's really well positioned content that will give you the data that you're looking for. So ultimately, it also puts out data in the different types of reports that you may be required to or requested to actually achieve some type of goal as an organization, or some type of goal set regionally or whatever have you. So work within the tool, work with the tool, export data out of the tool, and continue to work with it. It's quite robust. So lastly, another case study about Manitoulin Center. So they leveraged our HQI tool because their response rates were miserable. They weren't great, and they're stellar now. They've achieved a 85% estimated response rate. They're better equipped to measure patient satisfaction and have an ongoing plan to be able to build a comprehensive quality improvement plan to achieve some of the goals that they set for themselves. So if there's people responsible for quality care out there, or executive directors that have a lens on this, this is a really hugely differentiating tool. So that's it. That's our portfolio of services, and what better way to talk about them than actually going on a patient journey. And so if you will allow me, I'll take you on a journey with a patient who is Jill. And Jill is referred into a clinic to which the receptionist takes it and indexes them into the EMR and books them. At that particular point, Jill will receive an email letting her know, or a text or a voicemail, letting her know that she's been booked. She's been referred in and she's been booked. Then she'll receive an appointment reminder letting her know, hey, Jill, it's time for your appointment. When you come, please be prepared to do this, that, or the other thing and bring these following things. At point of arrival, Jill will see a wait time display that lets her know how long the wait time is as a whole across the environment, but also she'll probably know where she is in the queue. She'll see the physician, and then a couple days later, Jill will get a really well-placed time survey on Net Promoter Score. How did that provider do? What did they do to align the expectations that Jill had? And then maybe even as a nice cadence, Jill may get another survey checking in, asking her specifically about her progress, specific to her, what she needs to know and what the provider needs to know, that they align on what Jill's healthcare path is. And then based on the responses, the nurse or provider or whomever can follow up with Jill in a really, really targeted, effective manner. So what do those Cliniconex services look like that have been brought to bear to be able to do this? So booking notifications, appointment reminder, the waiting room concierge suite of services, and then our health quality improvement from a surveying, polling, and feedback perspective are all those things that are brought to bear that give the before, during, and after patient journey experience that's cohesive and ties Jill to everything that she needs to know and gives the provider everything that they need to execute on. So, we've talked about problems, we've talked about solutions, and I think it's important we talk about outcomes. And so the outcomes are really received differently depending on who you are. So let's talk about everyone in the mix. Patients really have a much more positive and much more engaged experience, which allows them to really get the content they want the way that they want it and do with it what they need to when they have time to do it. It also aligns their expectations and creates a really positive sentiment. The medical office administrators have this immediate alleviation of a burden of a manual, antiquated process that's time-consuming and frustrating to manage as a result. And they're able to redeploy their time to do things that are much more meaningful, either within the practice or with the provider or with the patient, but really allows them to get their head above water and do things that are going to move them forward and move the whole patient-provider experience forward in a much more positive way, that they're not managing these logistical tasks. Providers have optimized schedules, they have reduced no-shows, and most importantly, they have patients who arrive better prepared with expectations of what's going to happen and what they need to know. So better informed, better prepared patients. You are running businesses, and I think it's important that we address it squarely. It's about increased profits and staff productivity, and it's about positive sentiment around your brand reputation and the way that you're being perceived as an organization. Lastly, and it's built in, but I know that it's a baseline requirement, it's about adhering to what you want to do by way of best practices, the type of messaging that you want to standardize on, the type of business process flow that you want to know that is being employed to optimize your practice to its absolute best capabilities. And so the service outcomes, we think across the board, are meaningful to everyone in the mix. So last case study I promise is the University of Ottawa Health Services team. So they are quite a big health services team. They have 100-plus healthcare professionals, a complete broad spectrum range of services, 250,000 patient charts in both French and English, and they're using PS Suite as an EMR. They really needed to improve their efficiency and reduce no-shows. They had problems with surveys and response rates and an incredibly busy waiting room. And so what they did is they looked across the portfolio of Cliniconex services and leveraged those services that they thought best suited their requirements. And so you can pick and choose from the services that you think best match to what you do as a provider or an organization. So it's important to know that if you take the appointment reminders as a suite of services, we're not saying you have to take booking notifications, clinic cancellations, and all the rest of those things. In fact, you may not want to use appointment reminders. You might want to use booking notifications and clinic cancellations exclusively. So University of Ottawa pulled from what portfolio services we had and employed the ones that they wanted. And it was a very complex environment, and we showed a great deal of flexibility, versatility, and insight in listening to what they had to say, looking at unique ways of managing their expectations, and then bringing to bear our years of experience to actually deploy a service that made sense for them. But ultimately, we reduced no-shows, we decreased their call volumes, patients arrived with the completed content and expectations that they needed to have aligned. There's a higher patient satisfaction, and their survey rate responses have gone up much higher. So that's the customer, but the customer's customer, the patients, really like the fact that they can check online before they arrive and really get a sense of what's going on and where they're at. And you know, they really like that they post their projected waiting times on the web and in the waiting room. And so yeah, that's a really great success story with TELUS, University of Ottawa, and Cliniconex. So that's the portfolio of services, that's the problem, solution, and outcome. Pricing and next steps are what we're going to demystify for you right now. And essentially, we go about pricing our products a couple different ways, and it's not to confuse the issue, but it's because we know who our audience is and the way they consume our services. And so first and foremost, the patient engagement, so appointment reminders, booking notifications, clinic cancellation suite of services, is transactional. You pay for what you use. You pay for the spikes in activity and the valleys in inactivity in doing other things. We know that providers' calendar across the calendar year is not always predictable. So The way that we rationalize our pricing from a transactional standpoint is a cycle, and a cycle is simply a single text message appointment reminder, or a single email appointment reminder, or a cycle of voice reminders. And the cycle of voice reminders can be 3 phone call attempts, including messages left. And so, that's great, but what does it all mean, and how do I rationalize ROI? And so, to kind of help you along that journey, if you were to use Appointment Reminder Suite of Services and remind exclusively on 200 appointments, the associated cost would be $70. And we're proposing that the cost of an appointment has a value of $75. It can be less, it can be more. We just sort of chose a benchmark. But in reminding for 200 appointment reminders, should you, as a result, remove one no-show, the service, in fact, is paid for itself. And so it's quite apparent that you can really arrive at a quick ROI and validate that, yeah, this makes sense and this would pay for itself. From the Waiting Room Concierge Suite of Services, so if you recall, that was the wait time display, the patient-provider queue, and the leave and return messaging. The way that it works is the wait time display is for the clinic. It's $200 per month for the clinic to display that wait time widget. And essentially, that's the tool that you can deploy onto your website or a web-enabled monitor screen device within your practice. The patient queue display is on a per provider basis, or you might want to just provide a single queue for your practice altogether. But it's $40 for each individual queue that you're demonstrating, $40 a month. And then the leave and return messaging is a little bit different. We're not going to penalize you for sending a message telling someone, hey, you've enrolled, and then hit you again with a price saying, hey, it's time to come back. We've grouped those together as a singular price of 35 cents transactionally. And then lastly, the health quality improvement, the surveying tool that you can use for your quality improvement strategy is based on 35 cents per roster patient. So let's say you have 1,500 roster patients in your portfolio, you'd be looking at about $1,500 on an annual basis for this service offering. So we really are all about workflow automation. We really are all about mapping your specific requirements to our technology stack. And so we have what we call a workflow session, probably more commonly known as an implementation session. We do a deep dive with your organization. We understand everything that has to do about what you do. We look at your data, we understand your data, and then we start mapping it against our technology. So the way that things play out is that you typically place your order with your TELUS rep. They provide us access to your EMR. We go through this workflow session where we look at your data and map it against our technology. That is a $500 fee, which also includes your lifetime support. And then we deploy, we get you up and running. So great news, everybody. We're waiving the $500 workflow fee, and we will do so right through until April 5th. So, there's a timestamp to that, so get a hold of your TELUS account manager and let them know that you have interest, and take advantage of that offering. So really, really happy to open it up to a Q&A session. I've done enough speaking. Kathy has done no speaking whatsoever, a lot of typing. But again, the services are before, during, and after. They're broken out this way. Really encourage you to ask some questions because, Kathy has a tremendous amount of insight to lend. So, Kathy, do you want to pull on something you've already been asked so far?
Sure. Yeah, just had a question from Stephanie asking about forms and can they be emailed to patients and do they print them in or are they updated into EMR? So I answered Stephanie and basically said that the forms can be attached to any of the reminders or any notifications that go out. And so they can actually be sent by appointment type, provider, location, et cetera. And so, yeah, they would get attached to the email, and then the patient would fill them out, comfort of their home, and bring them into their appointment, whether that's at the hospital or in the clinic. We can also point the patients to like a web page or a landing page if you have any forms or information about the appointment that's hosted on the website as well. So that's a bit unique as well. So if anyone else has any other questions, feel free to head over to the chat, and we'll answer some questions there. So we got one here. So what are some of the main challenges that we face when implementing the solution at hospitals? So I think when it comes to hospitals, Lisa doesn't say maybe challenges, maybe just a little bit of a slower process when it comes to implementing through ITs, just going through our PIAs. But we have PIAs, so the process still, essentially we don't have any issues. We can still do the implementations and get through them. We're implemented in many hospitals across Canada. So hopefully that answers your question. Checking to see if anyone else has sent in a question. We did here have a question about managing specialist and referral appointments. So I'm not sure specifically about your workflow, but we can talk specifically offline about your needs specifically. But in specialist clinics, the way we can manage referrals, I think Darcy touched on it a bit previously. So that could be related to booking notifications. So as an example, when you book the appointment in the EMR, we can send out what we would call a booking referral notification, which essentially just lets the patient know that we've received the referral from the referring provider, lets the patient know the date and time that they've been scheduled at your clinic, along with any special instructions related to that appointment, and the patient can either confirm that they're going to attend that specialist appointment, or that the date and time doesn't work, or that they want to cancel it, and then the specialist clinic would send back the referral to the family provider, as an example. So we have a lot of specialists using that option.
Yeah. So really great stuff. It's been fantastic, going through and unboxing our services for everyone on the call today. Again, we've been working with the TELUS Health organization for a long time, tremendous success. We've spoken to many of the different EMRs that we've integrated with regards to their portfolio of services. And we encourage you to keep the conversation going. Send through your questions. I'll actually bring up that screen now. So for more information, you can reach telesales.emrs@telus.com. You can learn more about Cliniconex on our website. And Kathy and I, the Cliniconex team and the TELUS organization remain at the ready. Kathy's waving me. I think she's got something else.
We have a few more questions, so I'll just answer those quickly before we sign off. So 2 questions. Someone asked if the follow-up survey is needed. Nope. As Darcy mentioned, you can sign up to appointment reminders only, cancellation notices only, surveys only. You can kind of pick and choose from the suite of services that you'd like. Another question, are confirmation and cancellations of reminders documented into the patient's chart? And yes, they are. In the scheduler, right beside the patient's name, you would receive a code which would show confirmed, canceled, left message. So hopefully that answers your question. And then someone else has a question about many patients are elderly. Is this a software used for seniors? Yes, typically with seniors, we would just recommend that those patients opt in for voice reminders.
Yeah, and with regards to the voice reminders, sometimes there's concern around the actual sound and cadence of the voice reminder. We have a number of different options that we can accommodate, and again, we can work with you on the script and have the script specific to your patient base or target audience so that it's clear and aligns with the type of information that your patients would want to know or you as a provider want to get across.
Yes. And then there's one more question. Does the waiting room concierge system have the ability to integrate patient self-check-in?
Wow, that's such a great question and super insightful. Cliniconex has been rounding out its portfolio of services to really have a cohesive before, during, and after patient journey. So to answer your question, presently, no, but this is actually something that we're internally testing now. We're battle testing. We do not go to market without products that have been well vetted, well tested, and benchmarked. So yes, we're driving towards that, and we know that that's a near-term item that has been requested and is almost, I think, at this particular point, with the amount of educated purchasers and users out there, I think it's almost at a point now where it's a baseline expectation.
Great. A comment from Michelle. Let me just pull it up. Our clinic is very interested. Can someone contact us to discuss?
Yay! Of course someone will get a hold of you. Yeah, absolutely.
Great comment. Yes. Rochelle, somebody will be in touch with you as soon as possible.
Yvonne, on that note, I know that the TELUS organization remains at the ready. So as far as a way of a follow-up, it will be with TELUS Direct, and then, of course, Kathy and her team will remain ready to support conversations and distill down our services either independently, siloed out individually, or the bucket or vertical services that most interest your customers.
Yeah, so everyone who attended the webinar today will get a follow-up email with this webinar that is recorded, as well as a link to come back to us with any new inquiries. However, like Darcy has put up on the slide, I think the next slide, where there is an email. So if you are interested and you'd like to move forward, please do email us directly, and we'll get your quote out as soon as we can. So I think that's all the questions that we have. I think there's one more. I don't know if you guys can see this from Johan. How often can reviews be sent per year? I'm guessing is what the question was.
So
how many what, sorry?
How
often can reviews be sent per year?
So by reviews, maybe they mean surveys. Do you think that's maybe what they mean?
That's what I would assume. Johan, if you want, you can type it in the Q&A box. I know you sent it in the chat directly to me. Surveys, yes. Okay, yeah, he wrote surveys, yes.
Okay.
You can choose. So you could choose to do the survey once a year with one specific survey group of questions. You could choose, an example, in January, this is your set of questions you want to ask, and then periodically you want to change up the survey. That's okay. So it's really about, again, your workflow and how you want to manage it.
Yeah, so again, the services are something that can be broken out individually to map your specific profile as a provider, as practice, the cadence in which you use it, or the amounts in which you leverage the services. It's entirely up to you, and that's why we spent that little bit of time at the forward of our presentation talking about workflow, because that is a really unique differentiator, and that's what sets us apart. And that, quite frankly, is why providers, once they deploy our services, stick with us for a very, very long time. So, Yvonne, I'll take this opportunity to thank everyone on the telephone who's participated, those who are listening post-event, and, of course, the TELUS organization for the opportunity to present our service offerings. Thanks very much.
Perfect. Thank you, guys. Appreciate it. Have a great day, everyone.
Thank you.
Take care. Bye-bye.